Hi, welcome back to IU Radiology Case of the Day. My name is Nick Kuntz, and I'm a neuroradiologist and head and neck imager at Indiana University School of Medicine, and I'm back with another interesting brain case of the day. Before I get started, I'd like to state up front that all of the educational content found within this talk has been completely de-identified to protect patient privacy. So the history in this case is that of a middle-aged woman who presented with altered mental status. I've got three images for you to look at. The image on the left is an axial T1 post-contrast. The image in the middle is a T2 weighted fat-saturated image in the axial plane. And then the image on the right is an axial 201 thallium SPECT image. So take a look at the three images here. Again, keep in mind, middle-aged woman, altered mental status. Take a look at these three images and try to piece this all together. All right, what are the findings? What's your differential diagnosis? And what would your top diagnosis, or maybe your top two diagnoses, be in this case? Okay, let's take a look at the imaging. First up, we have our axial T1 post-contrast image, and what you should see denoted here by this yellow arrow is we have a left frontal lobe lesion. Now this lesion is out in the periphery. It's sort of centered right at the gray-white junction. And importantly, this has a ring of enhancement surrounding it. This is a complete ring of enhancement. You could take a pencil and completely trace around that ring of enhancement in this case. As we take a look at our T2 weighted image, again, we see this left frontal lobe lesion. Centrally, it's T2 bright, but if you look right where that arrow tip is pointing, it has some peripheral T2 dark signal intensity. And then immediately outside of that, you can see that there's surrounding vasogenic edema. Next, we take a look at the axial thallium SPECT, and we can see that there's associated marked thallium uptake with this lesion. And as we look around, we can see there are no other lesions. Now you may wonder what's going on out at the periphery on both sides. We can see that there's physiologic thallium 201 uptake within the temporalis muscles bilaterally. Thallium gets taken up by skeletal muscle. Maybe this patient was chewing, they have bruxism, perhaps that's why it's so increased, but this corresponds with their temporalis muscles. So this is physiologic uptake in the muscles. So again, what we have a ring-enhancing lesion at the gray-white junction, centrally T2 bright. It's got some dark T2 signal intensity out at its periphery, right where it's enhancing, perhaps something that's a little bit more cellular at its periphery. And it has associated thallium uptake. So what's your differential diagnosis, and what's your top diagnosis going to be here? So this was a brain metastasis. In this case, it was due to breast cancer. And I'm showing you this because it's an important point to drive home about the thallium scan. We affiliate this oftentimes with being a scan for lymphoma, but it's not specific, and I'll touch on that in a minute. So even though it seems like thallium 201 is sort of an old school technique, and in many ways it is, it still can serve as an important troubleshooting tool. So historically, it's been employed for differentiating infection from malignancy. That's where it really shines in its traditional role, especially in immunocompromised patients, in which CNS lymphoma can look very much like CNS infection, particularly toxoplasmosis. So that's been the major historical role of thallium for brain imaging, is to differentiate CNS lymphoma from toxoplasmosis in patients with HIV/AIDS. But that's not its only role. So thallium 201 is a potassium analog, and it gets taken up by viable CNS neoplasms thought to be mediated by regional blood flow alterations and breakdown of blood-brain barrier. In general, and this is certainly not a perfect paradigm, but in general, it's taken up by brain neoplasms, and it's not taken up by the normal brain parenchyma, and it's not taken up by non-neoplastic processes such as infection. The literature is full of examples of when this falls apart. But in general, if you had to memorize a key concept about it, it's that thallium-201 is taken up by brain neoplasms and it's not taken up by infection. And that's where the role in the past, in particular, has been in differentiating CNS lymphoma in immunocompromised patients from toxoplasmosis, because the CNS lymphoma would take up thallium and the toxo would not. As I said, there can be exceptions to that, but that's the general concept here. While this is classically associated with lymphoma, it's not a specific tracer for lymphoma. Other CNS neoplasms, and in this case, a metastasis, can take up thallium. So it can be used for differentiation of other malignancies from infection. So in this case, it was a useful agent in depicting this metastasis and differentiating it from an infectious source, such as an abscess, such as toxoplasmosis. Higher grade malignancies can also take up thallium, so primary brain tumors. One of the other historical roles of thallium would be to use it in order to help differentiate what is residual or recurrent neoplasm from post-radiation changes with CNS malignancies. So keep in mind, just to summarize one more time, it's not a specific agent for lymphoma, although that's where it's most classically been used. Malignancies, neoplasms tend to have the thallium uptake, whereas infectious processes tend not to have thallium uptake. Okay, kind of an older paper, but a nice paper for demonstrating these concepts and walking you through thallium uptake scans in the brain is this paper by Kessler et al. That was published in AJNR several years ago. For all the residents and fellows out there, this is worth taking a peek at just to drive home these points. So let's wrap this up. This was a brain metastasis, a breast cancer metastasis, and I showed you an MRI and a thallium scan. So on MRI, we had a ring-enhancing mass at the gray-white junction. It was peripherally T2 dark, which corresponded with areas of more cellular tumor, and there was surrounding vasogenic edema. On the thallium-201 SPECT, we saw increased thallium uptake corresponding with the lesion. As I said before, there are some pitfalls. Although it's less commonly used in clinical practice in this day and age, I think thallium-201 SPECT can certainly remain a helpful tool in differentiating CNS neoplasia from infection. This is a nice tool to have in your toolbox for those challenging cases in which you want to do some troubleshooting. And again, as I said before, although this is classically employed in lymphoma imaging, it does lack the specificity in differentiating it from other malignancies, as in this case, in which we demonstrated its uptake within a brain metastasis from breast cancer. So as always, thank you for tuning in. I would invite you to check out our complete IU Radiology Case of the Day collection that can be found at radtf.iuhealth.org/COTD. And as always, please follow along on Twitter, where I post these cases routinely. You can follow along at NA Kuntz. Thanks so much. Have a great day.